Welcome back to LCFA, Lung Cancer Foundation of America's World Lung Cancer Day social media takeover. This is a chance to raise awareness and raise hope.
And when it comes to lung cancer, one of the most powerful tools in a patient's toolbox might not be a treatment, it's a test.
Yeah, it's called a biomarker test, and it can reveal the genetic makeup of a person's tumor. Now, that information helps doctors match patients with the most effective, personalized treatment.
In short, knowing your biomarker can mean better outcomes, fewer side effects, and more time.
Here's an LCFA grant recipient and a patient advocate to explain why biomarker testing could be the key to getting the right treatment at the right time.
Can you tell me a little bit about what a patient ought to ask a doctor about biomarkers?
So let me tell you about kind of how I think about, or what a biomarker is. So really when we use the term biomarker, it's kind of shorthand for clinically actionable biomarker. So a biomarker could include a bunch of other things, but the ones that we really care about, clinically actionable means it helps your doctor make clinical decisions about how to tailor the treatment for your cancer to you and your cancer specifically. Most patients, when they're thinking about what's my biomarker, they're thinking about mutations that happen in the early evolution of the cancer, where the mutation really drives the progression of the cancer. And for some of these, EGFR, ALK, ROS, RET, KRAS, BRAF, and some others, there are, in many cases, oral therapies. In most of those cases, we're talking about oral treatments where the drug is not killing every cell, not killing every cancer cell, but only a cancer cells that has that mutation biomarker.
So I'm sure a lot of people would be wondering, is biomarker testing covered by insurance?
So biomarker testing is an essential component for non-small cell lung cancer. And your oncologist you should ask these questions to your oncologist, and they will tell you if biomarker testing is right for your cancer. And it almost always is, although there's sometimes very small cancers where there's not any proven way to act. But even then, even then, most of the time insurance will cover. But in the later stages, where it's patients that are undergoing radiation, or where the cancer may have already spread out of the lungs, a stage 4 case, those are all in guidelines, and insurance companies should be covering all of that testing.
It's time to meet more friends of Lung Cancer Foundation of America. This is a couple living in South Carolina who, despite a small cell lung cancer diagnosis, are still enjoying boating. Lung cancer has changed their lives a lot, for sure. But thanks to research and new treatments, thanks to your support of LCFA, they continue to navigate life with purpose.
Hi, we are Jim and Gail Fackler of Lancaster, South Carolina. Jim was diagnosed with stage 4 extensive stage small cell lung cancer in September of 2021. As a Vietnam veteran, he was exposed to Agent Orange as well as asbestos. Our journey has not been the one that we chose, nor has it been the one that we hope to be living in our retirement years. But it's been a long and tiring journey instead, with going to chemotherapy, radiation, and immunotherapy. But being the fighter that Jim is, we got through it, and it hasn't stopped us from living life. However, it did leave Jim with lasting side effects from the cancer treatments, which is slurred speech and the ability to walk with He has to walk with assistance. We love being out on the boat and enjoying nature and the beauty around us, as well as spending time with friends. Lung cancer, even at stage 4, is no longer a death sentence. We've learned to find joy in the small things, which is the beauty around us. For more information on lung cancer, go to lcfamerica.org.